So these are the disadvantages of using, sharp objects, or finding sharp objects in the sawdust. So this is one of the disadvantages of that. So you can see we have the foot. Should it be a disease or well, it's not really a disease because it's just a condition because it has been pricked. This one you can see the foot, the skin between the toes has been pricked like that, and it's swollen. It's coming out very clear. Okay, let me try this. Okay, and it's swollen, as you can see that. Yeah, it's a swollen. So I think that's blood which has just stuck together. You see, when there's a wound, blood actually sticks together like that. So what we have to do is actually press it out, apply some force here, force out the the blood which has actually stuck together, and then well, you can also see on this foot like this. So I'm surprised that there was actually two of them have been infected like that. So this is the condition right there. Look at that. So there's a big toe right there, and then between that you can see some what looks like it's very hard. By the way, it's very hard. When I try to press it, it's very hard, and I think the chicken is in a lot of pain because this is a foot. There's a lot of sensory. It's a lot of sensory tissues here. So that's why when I press it, you see the chicken is twitching like that. So it's a very sensitive area. So let me just press out the blood. It has actually hardened out like that. So I have to press out, and then I applied some maybe some alcohol on it, just to to prevent bacteria or any other organism from getting in. So food conditions like these are very common when you are using sharp objects, when you have sharp objects in the dust like this. So what you do, you can see the foot is very swollen, and it's very hard, by the way, because actually blood has stuck together. It was actually pricked, and then blood in it. There's actually blood. Also this one, you can see it has stuck together. There's some point of I don't know, is this some kind of entrance there? Surprisingly, it's on both feet like that. This one has also had this, has it, and also this one has it like that. This is some sort of a point of entry. So what I have to do is actually to squeeze out, because it's very hard. By the way, when I press it, it's very hard, and the chicken is very sensitive to that because it's feeling a lot of pain. So let me just press out the hardened part, or which is actually blood, and then apply some alcohol based maybe material or liquid so that to clean out the wound. Okay, so I'm done with that. Now squeezing out the liquid, you can see some blood there. It's a very tedious process because also very painful because you have to squeeze out, and whatever comes out is actually this one. It's very disgusting. This is actually pus. That is a pus, the material which has the awful smelling material, which is actually you can look at that. It is actually stuck together. Now initially it's actually a liquid, a foul smelling liquid, but after sometimes it gets sticky, and then that's why you get the lower part of the foot is very hard. You can see, so that section becomes very hard because the pus has actually hardened. That liquid has actually hardened into that. So this is mostly bacteria and non-required parts of this is how the body gets rid of some bacteria. This is actually some bacteria and other non-essential elements in the body. So like that. So I've squeezed out, I think, most of it. Some blood came out like that, and because let me just show you this. Yeah, some blood came out of the chicken like that because you have to apply some serious force there because the whatever comes out is very thick. It's very hard, rather not thick, but very hard. So you have to do a lot of pressing, and it hurts the chicken because I saw it, closing the eyes, which means it's a very painful process. So that's it, guys. This is how you go about this, dealing with these food conditions in the layers. So as of whether this affects laying, I really don't know because I really don't think so because this is majorly a food condition. Doesn't really affect it's not really a respiratory thing or an internal thing. It's actually an external thing which doesn't really have nothing to do with the egg production. So these sections, these are legs, they have nothing to do, but it was something affecting the internal organs that will have something to do with the eggs and will affect their production. But for this instance, I don't think so.